Then we have leukemias. So leukemias are characterized by neoplastic proliferation of white cells. So when you talk of leukemia, when you talk of leukocytes, you're talking of white cells. So proliferation of white cells or their precursors within the bone marrow, which then circulate within the peripheral blood. When you talk of precursors, you're talking about, for example, the immature cells before they become those particular white cells. So after they've been produced, now they circulate within the peripheral blood. That is coming out of the bone marrow, goes into the blood vessels, the arteries, the veins, so they circulate within the body. So they form one or more neoplastic cell lines. So basically, depending on the line, it could be myeloid, it could be the lymphoid, it could be those immature lymphoid cells that are developing into a leukemia. So they can form one line of them or several lines. So suppression of normal hematopoietic activity by the... If you have to do examine the blood in a person who has leukemia, the total leukocyte count is usually raised. Yeah, however, it's not always the case, but in some cases it may actually be normal or even low. Yeah, so if you have to do a full leukogram with somebody with leukemia, likely actually most of the time it tends to be very high. You also will see a high level of white blood cells. So in that case, of course, you have to do a bone marrow aspiration to find out which kind of cells are these. Why is it that the white cell, the total white cell count are elevated? So you have to do a bone marrow aspirate of peripheral blood film to be able to examine and see which types of white cells are actually elevated. So proliferating immature leukemic blood cells crowd out other blood cells formed in bone marrow, causing anemia, that is low hemoglobin level, thrombocytopenia, low platelets, and leukopenia. So when you talk of leukopenia, so you generally have what we call pancytopenia. So all cells that are produced within the bone marrow are decreased in number. So it will just be the blood cell. Blood cells are at that level where they're not mature yet. So this one crowd out every other cells. Yeah, it suppresses the bone so that it's only producing those blood cells at the expense of the others, of the red blood cells. So you end up with anemia of the platelets. So you end up with thrombocytopenia. And also the other types of white cells. Remember, it could be just a specific white cell that is being produced in excess or proliferating at the expense of the other. So all that we talk of pancytopenia. That is basically the cells that are produced in the bone marrow are low, apart from that particular blood cell that is causing the leukemia. Because the leukocytes are immature when released, immunity is reduced and the risk of infection is high. So generally, in leukemia, the white cells don't mature fully. The majority of them don't mature fully. And so the immunity, because white cells generally are the one that help us with defense of the body. So if you have that decreased immunity, then you have high risk of infection. So people with leukemia, they tend to have other infection. The risk of infection for them is higher. So what causes leukemia? To a great extent, many of the causes, they are not known. They are unknown. But these are some of the things that are thought to be risk factors, like ionizing radiation. When you talk of ionizing radiation, you're thinking about X-rays, the X-rays that we use in CT scan, and so on. So those are ionizing radiation. Or, for example, in atomic bombs, they release those ionizing radiations. And also some chemicals like benzene. We have also cytotoxic drugs. Those are drugs that cause injury to cells. Also asbestos, which we talked about when we talked about the respiratory system as one of the cause we think could cause lung cancer. So it can also, it's thought that it can also cause leukemia. And then there are some genetic factors which are triggered by environmental factors, including viral infections. So there are some viral infections that are thought that with somebody with genetic abnormalities can trigger it to start developing leukemia. So the usually leukemias are classified according to the type of cell involved. They're also classified according to the maturity of the cells. So most acute leukemias, mostly the cells will be mature. If you talk of chronic leukemias, the cells will tend to be towards a bit more mature compared to acute leukemia. So the maturity of the cells, and then the rate at which the disease develops. So the type of cell involved, that's why you can have myeloid leukemias, you can have lymphocytic leukemias. And the rate at which the disease develops, this is the one you talk about, acute or chronic. Yeah, acute tend to develop very fast, and then chronic tend to be slow. So acute leukemias, those usually have a sudden onset and affect the poorly differentiated and immature blood cells. So mostly these are caused by immature blood cells, and the rate of onset is sudden onset. So neoplastic proliferation of very immature white cells. So the blood cells are the ones that proliferate or increase in number. So mostly very immature white cells, the blood cells, and that is acute leukemia. So the course of the disease is very rapid with destruction of other hematopoietic cell lines in the marrow. So it suppresses all the other lines so that maybe the red cells are not being produced, and even those other types of white cells are not being produced. The platelets are not being produced. So it suppresses or destroys all the other hematopoietic cell lines in the marrow. So this one usually will be rapidly fatal without treatment. I think when you talk about, I'm sorry, that is a typo. It should be fatal with it should be fatal with the fetal, not fetal. When you talk of fetal with A, so FA is not fetal. Fetal is referring to fetus. So it's rapidly fetal without treatment. So FATAL. So it will usually rapidly fatal. FATAL. The fetal of FE, that is referring to the fetus. So if you don't treat, acute leukemias usually will lead to death. Yes, if it is not treated. So they can be aggressive disease, especially in older people. So especially if you have an older person with acute leukemia, they tend to be worse than if it is in a younger person. So acute leukemias in older people is very aggressive. Yeah. So rapid progress of bone marrow invasion quickly causes bone marrow failure, and it culminates in anemia. Rapid progression in bone marrow invasion quickly causes bone marrow failure. So this when you talk of bone marrow failure, when bone marrow fails, so it doesn't produce the blood cells as it should. And this may lead or may culminate in, because there are very few cells being produced. It may lead to hemorrhage, that is bleeding, because very few, for example, platelets are being produced. So you end up with thrombocytopenia. And you know, one of the functions of platelets was clotting of blood. So you end up with just bleeding. And of course, susceptibility to infection, because generally the white cells are not, although there are many, but they are immature, they are abnormal, and the other lines of white cells are not being produced. So you end up with susceptibility to infection. So somebody is at greater risk of getting infection. So the mucous membranes of mouth and upper gastrointestinal tract are most commonly affected. So in somebody with acute leukemia, it tends to affect the mouth and upper intestinal tract. So talking about the esophagus, the stomach, up to maybe the duodenum. So those tend to be most affected. So leukocytosis is elevated number of white cells. So if you do a full hemogram or complete blood count, you will see the level or the number of white cells will be elevated. So WBCs will be very high, white blood cells will be very high. So leukocytosis usually present. But as we say, of course, it cannot be always present, because you can actually have situation where the white cells are actually low. Bone marrow is packed with large numbers of immature and abnormal cells. So if you do a bone marrow aspirate and examine the bone marrow under the microscope, you'll see a lot of large, immature, and abnormal cells. And then, of course, we have types of leukemias. And of course, you realize, you go to the books, there are so many types and even classification and so on that are a bit complex. So I think for me, at your stage, all you require probably is to know this one, that they are acute. In acute leukemias, you can have acute myeloblastic, or in some books, you will talk about myelogenous. So it's the same thing. Acute myeloblastic leukemia or acute myelogenous leukemia or acute myeloid leukemia, it will still mean the same thing, AML in short. So these are proliferation of myeloblasts. So if you go back to look at the stem cells, how they differentiate, I think we already talked about that diagram. So go back and look at it, how they differentiate, so you can see where the myeloblasts will be. So myeloblasts are the ones that increase in number. So it is common in adults between the ages of 25 and 60 years. Yeah, and the risk tend to increase with age. So this one can often be cured, or you can have long-term remission achieved. So you can have a long-term remission. So that is basically, it can be suppressed for a long time, but they can also be cured. Then we have acute lymphoblastic leukemia, ALL, which is seen mainly in children, and they have better prognosis than adults. As we say, generally for leukemias, acute leukemias in adults have a poorer prognosis. So they tend to have a better prognosis in children than adults. So, but they can also still be found. Remember, we are saying it's mainly in children, but it can still be found in adults. So up to 70% achieve cure, that is in children. And the cell responsible mainly is a primitive B lymphocyte. So we have acute lymphoblastic leukemia. And then, of course, we have a blood slide. Basically, that one, you took some blood samples, or maybe you took blood from the bone marrow. Most of the time, we do it from the bone marrow, but this one mostly is from the blood. We call what we call PBF. PBF is peripheral blood film. PBF, peripheral blood film, PBF. So you are basically spreading on a glass slide and staining it and looking under the microscope. So acute myeloid leukemia, this is what you are likely to see. You can see the myeloid blast, those immature myelocytes. And then you can see what we call AUA rods, which will be common. And of course, you can see on the left, on the right is a microgram that is under the microscope being stained, and then on the left is the diagram. And then acute lymphoblastic leukemia, ALL, looking at the peripheral blood film, those are what you're likely to see a lot of lymphoblasts. You see a lot of lymphoblasts as opposed to the myeloblasts. Then we have pro-lymphocytes, then we have lymphoblasts. So that in itself will help you know that this could be acute lymphoblastic leukemia. Then we have chronic leukemias. These are characterized by neoplastic proliferation of relatively mature white cells. So if you compare with the acute one, this one, the white cells are a bit more mature, but are not completely mature, and even they may be mature, but they are abnormal. So characterized by neoplastic proliferation of relatively mature white cells. So typically the clinical course is indolent with a long natural history. When talk of something indolent is, it is not very aggressive, and even the patient may be symptomatic. Sometimes some of them are discovered incidentally. So maybe during laparotomy, for example, you find that in the mesentery there is a very enlarged lymph node which you decide to remove, and then you take it for histopathology, and then it comes back as a chronic leukemia. So that's why we talk about indolent. It's something that is not aggressive. The patient may even be asymptomatic, and so they have a long natural history. So sometimes even if you find them in a very old patient, you don't have to aggressively treat it, because eventually with the old age and so on, the treatment of the disease may be worse than the disease itself in such a scenario. So we have adequate, but in this case, you will still have an adequate number of red cells and platelets are produced. So that is why somebody will be asymptomatic likely, because the platelets are normal, the right amount of red blood cells are produced, so the person may not even have anemia. So mainly seen in adults over the age of 40 years. Some may eventually transform into a more aggressive acute leukemia. So this is the one that usually end up now causing disease and causing symptoms in the patient, and they may actually transform into acute leukemias. So leukocytosis is a feature. So when you check at the blood, you do a fulmogram, or you do a bone marrow aspiration, you will find there is leukocytosis, that is elevated white blood cell count. So there is crowding of bone marrow with immature and abnormal leukocytes. So as we say, they are relatively mature, but still they will still be immature. So we have also the types of chronic leukemias. We have chronic myeloid leukemia, CML, which occurs at all ages. An onset is usually gradual, which is caused by abnormality of chromosomes 22 and 9. We call it Philadelphia chromosome. There's a chromosome called Philadelphia chromosome. So I think it is around the area where it was discovered. Philadelphia, there is in the US, there's a state called Pennsylvania, something like that. That's where Philadelphia is located. So unusually for this chronic myeloid, death usually tend to occur within 5 years. But as we said, mostly because it's the elderly, sometimes may be discovered much later. It can be in all ages, but most of the time discovered in the elderly. And usually, so within 5 years, that is we talk of prognosis. Yeah, after this diagnosis, sometimes many people don't go beyond 5 years. Then we have chronic lymphocytic leukemia, CLL. This one involves proliferation of B lymphocytes, usually less aggressive than CML. If we compare it with chronic myeloid leukemia, it's less aggressive. Most often seen, so this one will be seen most often in the elderly. And the progression of disease is usually slow. The survival times can be as long as 25 years. So after diagnosis, somebody can live even up to 25 years. And then we see the peripheral blood film showing the chronic myeloid leukemia. You can see the metamyelocytes. You can see myelocytes, those cells. So if you look, you realize those cells will be elevated. The myelocytes will be increased in number in that stain that you've looked at. And then we have the chronic lymphocytic leukemia. You have those cells that we call SMART cells. We have lymphocytes. And if you compare, you realize the lymphocytes in this case will be smaller, much smaller.